I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Helios Cancer Clinic. Now let me take this opportunity to talk to you all about esophageal cancers. So I'll talk to you about the symptoms of esophageal cancer, how they are evaluated, how they are treated. So the typical esophageal cancer patient is an elderly male who has got difficulty in swallowing. So any such symptom like food getting stuck in the throat or the food pipe in an elderly person needs to be investigated. So the usual test which is done is an endoscopy, where a lighted tube is passed through the mouth and the esophagus is visualized, and if there is a lesion, if there is a suspicious lesion, then biopsies are taken. Basically there are two types of esophageal cancers and there is some difference in the treatment and outcomes. One is called the squamous carcinoma, another is called the adenocarcinoma. The squamous carcinoma tends to happen more in the upper portions of the esophagus, whereas adenocarcinoma happens in the lower portions, where the part where it joins the stomach, or what we call the gastroesophageal junction. So the biopsy will confirm whether there is cancer or not. Next we have to see the extent of spread, and for this we prefer investigations like a CT scan or a PET scan. So depending on this we decide what stage the esophageal cancer is in. Now most of the cancers now require multimodality treatment, that is, there is usage of surgery, chemotherapy and radiation. What has happened in the last few decades is that the chemotherapy and radiation has shifted to the neoadjuvant setting or before surgery. So most cancers we start the treatment with the chemotherapy and radiation, get a good response, shrink the tumor as much as possible, and then go for surgery. Usually either chemotherapy is used, or in some cases chemotherapy and radiation is both used prior to the surgery. When it comes to surgery, esophageal cancer surgery is one of the more complicated ones, and it requires a fair amount of experience because otherwise there can be complications. The setup too is very important, and a good ICU setup and a good backing of pulmonology and cardiology is required to perform these surgeries. Nowadays, these surgeries are usually done by the minimally invasive method, either thoracoscopically or robotically. What we do in this surgery usually is remove the entire esophagus. This procedure is known as total esophagectomy, and the replacement of the esophagus is usually done by the stomach, which is made into a tube and then brought up, and the anastomosis is usually done in the neck. The prognosis of esophageal cancer has improved quite a bit in the last few decades, and this has happened ever since multimodality treatment has happened, and we have started using chemotherapy and radiation prior to surgery. What used to be a deadly disease with less than 10% survival, now we are achieving cure in quite a few patients. So it is very important that treatment is received in a center where all the modalities of treatment are available. Thank you.